Welcome to Open Door with Dr. Brett, and I'm Dr. Brett, and I'm here today with Jerry Hilker, head athletic trainer, right? And at Texas A&M Corpus Christi. Is that correct?
Yes, sir. Absolutely. Thank you.
And how long you been here? Nice to meet you, Jerry.
Nice to meet you, and thanks again for having me a part of your podcast.
Awesome. How long you been at Texas A&M, and tell us a little bit about your experience, and then this whole COVID adjustment thing, and then we'll get into everything we can think of.
Sure, absolutely. Yes, my wife and I and family, we moved over from Tallahassee, Florida in August of 2005. So it's flown by.
Always does.
Yeah. I mean, 15 years later, and here we are. So dealing with the pandemic.
Jerry, my wife is Thai. And so the expression is, I believe it's Rela Panbai Reomak, which means time flies. I've learned it in other languages. It just does.
Yeah.
2005. Wow. That's a long time.
It is.
Like? What's the campus like? What's it like to work there?
It's beautiful. So kind of coming over from Tallahassee and that part of Florida, and into the South Texas kind of area, we're on the water. We're right on the water, actually, as a matter of fact. But that's the fun part of it, I guess. Everywhere I've pretty much lived in my professional career has been associated with Florida, with Texas now, and it's just a great vibe. So.
No state taxes. You've stayed away from state taxes your whole life, huh?
Right. I never thought of it that way, but yeah, that's a good point.
Oh no, it's an absolute pleasure because I'm coming from Connecticut originally, and then California, and I no longer have to fill out those quarterly state tax returns. It's wonderful.
Never thought of that, but that's a good point. But the campus here, it's a smaller campus. We're in the FCS level. We're not at FBS level. We are a Division I program here. We have 16 Division I sports, but we're right on the water. It's a beach community. It's a very the campus community is right around 12,000.
Wow. That's a good size. That's kind of perfect, right?
Yeah, it's a moderate size. It's not too huge. Yeah,
nothing crazy, right? It's not like Ohio State or something. How many people were in College Station? How many in College Station?
That's a good question. I'm assuming there's 30 plus thousand. I'm assuming it might be double that. But
hope not.
I hope not. But it's crazy. Some of the major universities. When I did my undergrad at University of Nebraska, and I think at the time when I was there, it was 20, 30,000, and I'm sure it's much larger now, but still, at the time, it blew me away. Just the number of people, the buildings, just the enormity of it all was just it's kind of awe-inspiring. And then when you go someplace like Michigan, University of Minnesota, or something like that, and you go to these high major to play sports and such, it's just amazing. And you watch game day, hopefully we'll have it at some point some way.
Some of the kids I'm talking to, I'm coaching a lot of college athletes, and one of the kids is a D1 quarterback, and they're at camp and they're looking like, for the D1 players, they might play in their division 8 or 10 games this year, not the regular season, but close. It looks that way at the moment.
Yeah, it kind of I think Big Ten kind of come out, and Pac-12 I think identified that they're just going to play conference only games. So it'll be interesting to see what that looks like and how that's going to be managed, because we're talking about it here within the Southland Conference. That's the conference that we're in, and of course we don't have football. The 13 schools that are part of it, Texas A&M, University of Corpus Christi, and University of New Orleans. We don't have football, but so we're kind of similar in that regard. But yeah, I can't imagine trying to manage all the COVID stuff that we're just doing with our sports plus football. It blows me away to think about that.
Yeah, it's pretty intense, but it seems like, football for certain schools is such a big deal that they'll figure it out,
It
right?
it,
It's a huge
it
priority.
is. It is such a driving force from a business standpoint
Definitely.
that if you don't have that money coming in, uh, $50 million, whatever, I mean, that takes your sports away. I mean, it's for your other sports that are non-revenue generating sports. So it blows me away sometimes to look back on that or reflect back on that and just say, yeah, you don't have college football. That takes that
Not to mention,
financial.
not to mention, without football, Americans are sort of, half of us are lost, right? It's like
Yeah,
so we kind of need football on some level.
and sports. I mean, America's game, baseball, right? I mean, you don't have baseball, you kind of lose your sense of I don't know, patriotism, but
Have you,
sports
yeah,
is
have
such
you
an
followed,
integrated
have you
part.
followed that so far? What's the status now with Major League Baseball? Have you been following?
I've been trying to kind of keep up with everything, and it's almost impossible for me with everything else that's going on with work. So I really can't give
What's your,
you.
tell us about your work. How'd you get into training, and what's a lot of people don't necessarily know what a head athletic trainer does. Obviously,
Sure,
people in, athletes do, right? And
sure,
coaches do, but outside of athletes and coaches, not everybody's that familiar. So
sure.
walk us through what a typical day is and how much it's changed.
Absolutely. Well, that's the it's an excellent question you bring up, is what is an athletic trainer? Because our profession, our title, our name, athletic trainer, really doesn't completely define what we do as a profession. So in the past, even our governing body and our membership, our members have a tough time with, what do we call ourselves? How do we identify, put an identity to that name? Because we have invested a lot of money just from kind of a signage standpoint, just to kind of illustrate, okay, to educate the public, what is an athletic trainer and what does an athletic trainer do? And, our education and prevention and care is one of our main flagships, if you will, as far as what we do. And yes, in my setting that I work in is specific to the collegiate student athlete, and that's my population group that I target, that I work with. However, there's athletic trainers obviously in the professional sports world, and there's athletic trainers that work in the UIL setting in our local high schools and in youth development programs, along with athletic trainers working as physician extenders or working in a situation, maybe in a medical office as a medical assistant, or even working in an industrial setting where they're working with like a worker from a ergonomics perspective or safety perspective, working in fit for work type companies or work
It's
fit.
interesting. I'm like, I'm thinking about a data scientist. I'm actually working with one data scientist right now, and I just can't picture him using an athletic trainer, but I know what you're talking about in terms of the ergonomics.
And that's just it. We're trained from a prevention and care standpoint. We have vast amount of education in anatomy and in prevention and understanding how the body moves. So we work very well in the allied health areas, and like myself and many others that are my age or older, we never went through an accredited program to where there was a specialization that's being developed. And there is that now with our accredited programs. And that's what I'm really thankful of, is our ability to not only adapt as a profession in allied healthcare industry, but for us as members in this healthcare community to be able to adapt in different situations, whether, you know, our patient is on a industrial type line working for a company such as Toyota, or working in any other type of industrial situation, or maybe in working with the military or police, or you know, the fire department and such. So we have a team-oriented mindset. We have a mindset as far as working toward a goal. So if you're part of this team, whether it's, you know, in an industrial setting, our idea is to be able to assist and facilitate those efforts with, you know, working with those individuals that are part of our team to meet that end goal. And a lot of that, the way we think, the way we operate day to day, may help out with, or will help out with, achieving that goal or that product. So a lot of times for myself, the end game for us in college athletics, right, is to be able to make postseason play, right? It's be able to get into your conference championship game, and then go on to the NCAAs. And that's what it's all about, right? I mean, it's, yeah, you play to win your conference games, or certain games within your conference, maybe a rival or something like that. But at the end of the day, it's all about getting these young men, young women prepared for play in a safe and efficient manner. And that's what we're kind of being challenged now with all the COVID, and being able to, okay, how do we acclimatize those individuals once we do start back in? So that creates more discussions, more questions. But a lot of, again, what we do, it's prevention and care. And at the end of the day, we're just trying to look out for the health and safety of our client. And in my case, it's working with a student athlete in a collegiate setting.
Yeah, it's you know, have you been? Well, I'm just curious. You know, if you, you know, are you wired as a bit of a caretaker? You're somebody that has always cared. Were you a kid that somehow was helping others? You know, maybe playing offensive lineman or something as opposed to quarterback.
You know, I grew up in a really small town in Nebraska.
Rural Nebraska.
Holbrook, Nebraska, right. Town of 200. We had Class D football, played 6-man football. Good gosh. I graduated in 1985. So most people, I graduated class of 4. That, you know, since then that school is consolidated with other local schools. But yeah, you know, early on, I would say, well, I had a knee injury when I was in high school, and I would say a lot of,
just repeat the end of that.
Yeah, sure. That's a good watchdog you got there.
No, yeah, she's like a 90-pound puppy.
That's awesome. That's a good bark right there.
Have you ever seen a Bernedoodle? They're pretty amazing.
No, I haven't.
She's like, they think she's a Portuguese water dog. All day, you know, I take her to the beach every morning, and people stop us. I can't go 20 yards without somebody saying, "What kind of dog is that?" She's big, fluffy, and curly, sort of white face with black, brown body or whatever, white tail and white paws. Pretty fun.
That's awesome. Yeah. That's great. No, yeah.
So anyway, so tell us about, you know, what were you saying to them?
So growing up in rural Nebraska, where I was, and you know, we didn't have an athletic trainer. I really didn't know what an athletic trainer was at the time, but I had an injury to my knee playing football, and it was my left knee medial meniscus tear and a partial tear of my ACL. And that was my junior year in high school. And I went to, which a lot of student athletes do, travel to another town, another community, Kearney, Nebraska, which is about an hour and a half away or so from my hometown. And they had like a clinic call where you could meet an athletic trainer, an orthopedic surgeon, take a look at your knee and kind of go through that. And that was really my first introduction. But prior to that, I was always interested in the body as far as movement and from a health science standpoint. And I knew at the time, I didn't want to go back to farming. You know, I love, you know, agriculture. I like to garden. You know, my roots are firmly embedded, you know, with my family and the family farm and that experience growing up in farming and the agricultural aspect. But I knew at that time, you know, I'm not going to make my living that way.
I hear you. You know what's interesting? You know what's interesting, Jerry, because I also graduated in 1985 from high school.
Oh, nice.
And I was a grad student in San Diego, and we used to play pickup basketball games all the time. And I would play really hard. It's just the way I was wired, especially in my 20s. And I had this injury where, like, I basically tried to stop on a dime and grab a basketball that was going to the other side of the court. And I heard all this sort of crunching noise and everything. Ouch. And then literally I played for an hour in slow motion. I couldn't figure out what was wrong with me. I was in slow motion. That night I was just messed up. There was something wrong with me. I woke up and my knee buckled. Literally, I couldn't put an ounce of weight. I couldn't walk. And then somehow I made it to the hospital or whatever. And an orthopedic surgeon misdiagnosed me. I think I did an MRI or something. He misdiagnosed me with a partially dislocated hip. I was only in my 20s at the time and didn't have any experience. And so he put me on crutches. I never got the personal trainer or the physical therapy or anything.
Yeah.
And I wound up with chronic pain for over a decade, like a nerve. I think when I look back on the experience, I probably had torn my glutes, you know, and so that misdiagnosis, along with a lack of treatment, created like a pain syndrome that took me, you know, more than 12 years to get on top of. And we're talking about every kind of like chiropractor, doctor, naturopath, mostly alternative medicine doctors, because I just didn't like like I never took any meds for the nerve burn. But what was fascinating about it was it seemed like the functional exercise people helped me the most, the ones that were probably more like a trainer.
Yeah. You know, and that's an interesting point you bring up, because a lot of times in medicine, especially I would say conventional medicine, things are put into a box and you look at just maybe the ankle joint or the knee, like you say you hurt your knee. Okay. We're just focusing on the knee. But, you know, the interesting about alternative medicine, and this is the thing that really helps from an athletic training perspective, is our profession has really, I would say, is open-minded to the other professions that are out there. So what I mean by that is, we're going to take on concepts that might historically just be associated with a naturopath, or we're going to take on concepts that might just be associated with an ART or with
an osteopath or something like that.
Yeah, exactly. So you want to look at the whole body, and I think that's the nice thing, and I think the physical therapy industry is opening up to that. One, in part because insurance companies will allow, to a certain degree, some of those practices, right? So the thing about athletic trainers is not all of us, or not all the states rather, have the open scope of our description of our profession, to where there's applied benefits that can be identified with with athletic trainers that are billing for those services. So a lot of times in conventional medicine, we are kind of hamstrung, so to speak, with what the insurance industry allows us to do. So it makes practicing medicine harder in a way,
Definitely, without a
unless you're
doubt.
just doing self-pay. So from my perspective in the college setting, I feel like, hey, I can play around with all sorts of different things, and I can make up my own decisions whether or not I like this method or I don't like this method. And, of course, we utilize, evidence-based approach in most cases. And that's kind of industry standard. And that's also an industry term too, that's being thrown around a lot is evidence-based research, evidence-based medicine, those kind of things, evidence-based practice, so those terms get thrown out quite a bit, but what does that really mean, and how does that apply to the individual that's utilizing that? And I would say for the consumer, you should ask, like, hey, what's your evidence-based solution to this type of injury situation? How do you approach this? What's your personal philosophy on that? That would be a good question, I think, for anyone.
Well, that's super fantastic to hear, because in psychology and sports psychology, a lot of it is about having an open mind. And I would imagine that, some healing from injuries, because as a sports psychologist, often I'll get a kid, a top athlete. It doesn't even have to be a top athlete, but a lot of times what will happen is they get injured, and then it's no longer the injury that's preventing them from making the comeback. It's the psychology behind it, right? It's like they lost their confidence, and the injury was a trigger, and now we're dealing with some version of the ifs. So I would imagine you're also dealing with a fair amount of psychology, right, in the recovery from the original injury, and also from a potential catalyst for the injury itself.
Absolutely. And that's something that I think as an industry standard, and as a standard for athletic trainers that are in my setting, there is a big demand. There's a big push for that. I think among us that are in here, we are trying to get as much knowledge and resources to where we can refer those student athletes over for care, to speak with a counselor. And if you don't mind me kind of throwing a bone out to one of our counselors on campus, her name's Suzanne Bonds. She's been a lifeline for me to help to try to bridge that gap. And in a lot of campuses, there's always been kind of a history or silos that are put up because athletics is kind of a silo. They're kind of their own bubble. And at least, here, and I know other campuses are trying to kind of break those silos down and open up and have maybe more of a medical model approach or holistic kind of approach as far as, allowing and having these other services a part of the regular student body, and kind of opening up the services that an athletic trainer can provide to that as well. And that's where here we try to open up maybe that breaking down that barrier with what does it mean to go see a psychologist or a psychiatrist, and what does a counselor do, and how do you incorporate that without having the fear, and maybe there's any stigma that's applied to it. So we invite it, and I invite a lot for Suzanne to come out to our practices to get to meet the student athletes, the coaches in their work environment, to see what the student athletes actually going through in that moment of time during the day. And it's really educated our counselors here, like, hey, our student athlete is, they're a unique type of population group on our campus. There's a lot of rules that kind of govern interactions and things that can be done for them from an NCAA standpoint, but also from a time management standpoint. They've got study hall, they've got these other demands that are placed on them from, academics and maybe film or something else from a coaching standpoint. But then they also have to find time to be a student, to enjoy the social experience of what college athletics is. They gotta eat. They gotta eat right, and maybe go see their registered dietitian. And then, here again, maybe they've got to follow through, do some more conditioning. They got to get up maybe with their counselor, and they got to find.
Well, you left one piece out of this, Jerry, is they also have to find a way to not drink and smoke too much as well.
Right. They got to stay within these rules, right? Doggone.
But in all seriousness, you sound pretty progressive because, I just spoke to a psychologist at Duke. She's also a sports psychologist at Duke University. And they just within the last few years created the behavioral health department for the student athletes, not just for the athletic body, not just for the body of students. So it's actually now, counseling services for athletes that's separate from the counseling services for everyone else. And that's relatively new at Duke University. So, and what I've found, because I've been working with athletes for at least probably 15 years, and I've found that in the last, 2 or 3 or 4 years, there's been a nice shift there. It's less of a stigma. I feel like it's less of a stigma than it's ever been. To have a sports psychologist, parents reach out to me. They've got, top tennis players, the kids. I just worked with an 11-year-old for 4 or 5 sessions, a couple months ago, and he was just having meltdowns and had attitude issues, and it was surprisingly easy to sort of get him off of that. I just had him, compare himself to Rafael Nadal because this kid was a lefty, and the attitude that Nadal has, and that seemed to work, right? We kept focusing on how amazing that, Rafa's attitude is, and this kid kind of got off of it. But it's cool. The psychology piece is less of a stigma, I think, than it's ever been. I don't know if you're experiencing that as well.
Yeah, I think so. I think this, the fun part of it is this generation is more willing to talk about it. With where I grew up, when I grew up, boy, you didn't talk about your problems.
No way.
I kind of joke about it with my mom.
Connecticut, trust me. We
Yeah.
do not talk to anybody.
No. You put on a straight face and you went right to work. And that. But,
or you didn't have a straight face, but you certainly didn't talk about it.
Right. True.
So
good point. But no, I do. I think that's what's fascinating for me. I'm 53 years old, and there's times where I feel like, holy smokes, I can't keep up. I don't understand what's going on. But
just meditate more, Jerry. You'll be fine. I tell everybody. If you're tired, stressed, or bored, meditate. But if you're worried about, keeping up, meditate more. Then you'll worry less. I promise you.
I'll do that. Thank you.
Literally, there's a direct correlation between the amount of time you spend. There's no research on this, I don't think, but from my perspective, the amount of time you meditate and the amount of time you worry, it's like an inverse relationship. If you have any kind of anxiety, sit in meditative states. I was up in the middle of the night last night because for whatever reason, I've got somebody that helps me out. He's in China and he was working on my website. In the middle of the night, I woke up. I don't know if it was intuitive or not, but I needed to send him a Google code at 2:30 in the morning. And I realized, I'm going to sit in the meditative state for an hour, and just because in the middle of the night, there's no interference, right? It's really fun. Right. Are you a meditator? Have you ever meditated before?
I yes and no. I've never done really formal meditation, if there is such a thing, but I've tried to read up on different techniques, quick tricks kind of thing. But I do, and this is kind of a personal confession. I love just being in a dark room. And what I realized when I grew up on a farm in rural Nebraska, it is dark, right? There's some ambient light that, you know, distant farms, whatever.
But the sky is amazing, right? The
Oh
light,
yeah,
the
yeah,
light
it's
show
great.
from
You don't get a whole lot of light pollution in in Western Nebraska. But what I used to do, because I really enjoyed running. You know, if we had cross country, I probably would have been a cross country athlete. But I enjoyed running as primary form of exercise, and so I would run at night. And of course, it's weird. You're on a country road. You're hearing animals and different things in the woods or in the ditches or in pastures and stuff like that. But there is, you know, some light from the stars, from the moon, whatever. So, you know, it does kind of bode itself well. And I like that feeling. And I came to the realization, I would say probably 2 or 3 years ago, that, man, if I'm having a rough day, because people don't want to see me like screaming and yelling and swearing and knocking stuff out of the way. So I leave, I go to a locker room area. The lights are on a timer. They go out if you're still, you know, and sometimes it helps me to just kind of sit in a black room, just
No, I
dark.
like it. You know,
Kind
I'm thinking playfully, Jerry, that you go to a dark room to get to a lighter place.
Hey, I like that. I like that. That's good. I have to steal that from you.
Yeah. So,
But
no,
that's
but
true.
seriously, everybody has their sort of style and their way. But part of the reason why I invite so many people to meditate is because it really does orient you. The more you meditate, the more you orient towards present moment time. And a lot of the fear and the worry and anxiety and the stress comes from this sort of like, future that almost never really occurs. You know, the
Right.
playful metaphor is the saber-toothed tiger. Like, rarely are you gonna, are you actually out on the Serengeti and you're gonna get run over by a wild animal. Most of the time it's the fear of the unknown, or fear of change, or fear of something bad happening.
True.
And when we meditate, we're training our nervous system to come back into the moment and to spend more time in the here and now. So neurologically, you're giving yourself a real boost, not just short term, but if you do it every day for months and years, you're actually building a lot of it's like a bench pressing or whatever in terms of your nervous system in the present moment. You can handle stress better. So this is an invitation.
Like
yeah. So this is an invitation for you to start a meditation practice. It's really simple. Let's do a quick technique right now.
Okay.
So we're just going to close our eyes and pick up the breath. Pay attention to the in-breath, the out-breath, one or the other or both. When thoughts come, we're not going to try to control them or push them away. We're simply going to come back to our focus, which is the breath. We'll do it real quick.
Okay.
All right, that's just a quick little minute or two. What was that like?
Great. No, it's good. It's refreshing. I feel my heart rate, everything kind of settled down. And in a way, that's what I do when I get an injury out during on a core. I work with our men's basketball program. So when
Mm.
we get an injury, I'll tell the guys, you, you let them have their moment of frustration, and I'll
Definitely.
remind them, hey, breathe, or one, where does it hurt? And if they're not talking to me, I'll just tell them, take your time, breathe in through your nose, out through your mouth. So I'll cue them on that. And before we even get up, a lot of times the officials are going to give you as much time as you need. Uh, but I let them, and I talk to them like, get your composure, get your poise. I'll give them a couple cues, because a lot of times they're frustrated, or they're embarrassed, or they're upset with whatever the call was, or whatever that didn't go their way. And so I'll give them a towel. They'll put it over their head most times, or they'll throw it. They'll throw it in the stands. But a lot of times, in a way, that's what I'm trying to do, is just get, neurologically speaking, central nervous system, calm it
Yeah, just
down.
get them to calm down in the moment when
Yeah,
they're under a lot of stress and
yeah.
pressure.
But
Yeah.
you're right. I think a lot of people just, whether it's just culture, or they just don't know how uh, to just do a reset. I mean, there is no button to push, but I mean, that is a nice
You
way
know,
to put it, is a
yeah,
neurological reset.
yeah, that's really well said. Jerry, I work with so many athletes, right? And I just got another D1 athlete. She's a track athlete at a big D1 program. And one of the things I like to ask is, how many hours a day do you work on the physical? Do you actually train? And she said to me 4 or 5 hours a day. And I said to her, how much time do you spend on the mental game? And because I had just done the first session with her a week before, prior to that, she had spent zero. And
Right.
then I asked her to meditate, because I taught her how to meditate, and I taught her about mindfulness practice and visualization and breath work. And I asked her how much time. I didn't say minutes, because I knew it wasn't going to be much, but I asked her how much time she spent in that week on the mental game, and she was up to like 4 or 5 minutes a
Great.
day. She's
Yeah.
spending 4 or 5 hours a day on the physical. And this
Yes.
is the thing that I found consistent, right? People train their bodies, but very few people learn how to train their minds unless they have some exposure to, to the mental game, to sports
Yeah.
psychology, and to people that teach it. Even trainers can teach some of this.
Oh, for sure. And that's something that we talk about. I mean, that's pain, right? Pain is from your mind. I mean, you get an
A little bit
injury.
of both. I just
Yeah,
broke a
but
wrist
there's
not too long ago.
yeah. I mean,
And the bone was
there's
sticking out of
that
my hand,
perception.
and a little bit of both.
Yeah, no, for sure. There's a physical,
No,
there's a
yeah.
physical component for sure. But and you've probably worked with patients that you're like, my gosh, this person's tough as nails,
But
or this.
very, it's a spectrum,
Yeah,
right?
yeah,
Like
right,
it's
right,
like,
for sure.
10% are insanely tough. 10% you touch them and they freak out,
Right,
and then
right. Well,
everybody else, it's like a continuum, right? Like a
yeah.
bell curve. Yeah,
and
definitely.
and it's all over the place, and that's exactly what I was getting at, was like, I'll have some kids that they'll be, they can play through about anything, but at the same time, um, you, you they may have a strong connection with a mind body connection, and then you might have the next person that you perceive that might be as tough as, or tougher, and then they
Well,
don't have
it's kind
that
of a tricky
awareness.
balance, because in sports, especially like football, they're all playing injured. In the NFL, they're all playing injured
Oh,
towards the
sure.
season. It's just a question of how much. And there's a lot of emphasis on how tough you can be and how much you can take, and how you can. But it's also tricky, right? Because you don't want to re-injure things and like mess yourself up for years to come. And so
Right.
that balance is always tricky, right? I imagine you deal with that quite a bit.
Yeah. And, here, I mean, working with a college athlete at the level where we're at with the FCS level, um, we are working with that a lot, to a degree where you'll have some kids on the same team, on the same team. You'll have that just wide variety and spectrum. And I would say that's probably the most frustrating, maybe for coaches and for the athletic trainers, because a lot of the coaches will complain to the athletic trainer, or maybe to the performance staff, our strength and conditioning, and say either one, they're not in shape, or two, they're just not tough. They're not tough. They're soft, and I hate that. Like, it's like, I understand, coach, where you're coming from. You're upset. You're pissed off because they don't follow. They're not doing this. And this whole perception of softness, that can be a very destructive type of description.
Yeah, it's super tricky though, isn't it, Jerry?
Yeah.
It's like, because there's not a lot of room for softness in
sports,
D1 or professional sports. Really, right? You kind of need to be tough, but some injuries are, way worse than other injuries, right? So it's got nothing to, so I would imagine the communication issue is also a big one with you, not just with the athlete, but also with the coaches and the coaching staff.
Yeah. And I would say that's probably the hardest, from being able to kind of read between the lines, and knowing your coaches, and your coaches having faith and trust in you, and the student athlete having faith and trust in you as the care provider. A lot of times the athletic trainer is seen as an extension of the coaching staff. And some of my kids will call me coach, and I say, no, hold on. I'm your athletic trainer. And I'll tell my coaches, please don't introduce me as a coach. I'm an athletic trainer. I try to stand separately from the coaches. So like the athletic trainer, a lot of time is on the opposite end of the bench, or it's on the bench where the water, where the water cooler and the ice chest and stuff are. But sometimes you might see in like professional sports, basketball, maybe the athletic trainer is up with coaches or a certain part of the bench area. But, as far as myself, I try to physically separate myself from the coaches as much as I can. And I tell my coaches ahead of time, like, hey, I need to be separate from y'all. Not that I'm not a part of the team.
Yeah, so the kids trust you more. You want the kids to have optimal trust, right?
Yeah,
and if you're
but it's still hard.
With the coaches, then they're not sure they're going to be able to share, right?
It's still hard. The whole communication and trust factor, it's really hard. The other thing that's hard is, like, I'm just an old white guy, and I've got a couple kids. No athleticism. I never played Division I sports, but again, I've been in the industry long enough, and a lot of the kids, they'll come right up to me and just start talking to me. And a lot of times I'm kind of shocked. I'm put back, like, oh, I don't need all those details. I appreciate you confiding.
I mean, you have an appreciation for why, as a male, it's very tricky doing psychology, right? It's like, It took me years to adjust, when I was like, because I'm an identical twin. My brother and I were really good athletes with no size, so there's nowhere for us to go. But like, I'm sort of wired that way. And so when I was in my 20s getting a doctorate in psychology, it was a rough transition to like do things like empathy and understanding and listening. I mean, really listening. I often playfully say, Jerry, that I listen more than any guy should, because we're really not crazy wired that way in general.
Right.
The really good listeners are pretty rare human beings, and yet it's such an important aspect of your job, my job, just life in general. Making your partner and your children feel safe and comfortable and loved. I mean, listening is a huge element of it.
Yeah, definitely. And that's no, you're absolutely right. I mean, most of the communication breakdowns we have, where the coach gets upset with the athletic trainer, or, there's issue where the AD has to get involved, or maybe a parent and the coach and the athletic trainer and the student all have to have this communication. It usually results around to a communication breakdown where the listening wasn't maybe fully understood or applied, and maybe the perception came off wrong. So we try to encourage face-to-face conversations as much as possible, meetings with coaches, meetings with student athletes and such. But now with this day and age of Zoom and WebEx conference calls, it kind of bridges that gap versus just the phone call and obviously the text message. But yeah, it's hard though. And it takes a lot of energy, like you identified.
I think
that's the other thing.
I was going to ask you earlier, what's the hardest part of your job? But I feel like you're answering the question before I asked it.
It wears me out.
Right. Yeah. The communication quagmire between the athlete and the coach, imagine, is probably one of the hardest aspects of your job.
Yeah. Even with my staff as a head athletic trainer, I've got 7 other staff that I work with, and all of us are great. They're very good. I'm very blessed with the staff that I have, and it takes a lot of just time and energy. And sometimes I find myself, someone knocks on the door, someone opens up the door, comes in, and they've got something really important they need to talk to me about, and I'm in the middle of something, maybe an email or something that I'm trying to respond on something else. And I'll keep kind of talking and listening, and I'm typing, and I'm like, okay, Jerry, I need to stop, and I need to turn, and I need to look the person in the face, in their eyes. And I need okay, you've got my attention. But it's hard. And I catch myself all the time that I am not hearing what the other individual is telling me. And from their perception, that it's important, and I got to be able to take that time.
This is pretty awesome stuff, what I'm listening to right now. I'm really appreciating you, Jerry. I'm just getting to know you, right? But I'm appreciating your skill set as a human being, and and your psychological sophistication. My wife, I was just telling a client the other day, that how important it is to listen, not just to your clients and your patients or whomever, right? But to your, the people in your personal life as well. Because a lot of times we humans have this tendency to take others for granted. It's something that I just don't do. I work really hard on that. It's important for me to live my life in a way that I take no one for granted. And so my wife, she's Thai, and her English has gone from 65% to maybe 85%, but at night, after I've done a full day of work and I've got so many moving parts here, to really listen when we're walking the dog, I have to work so hard, and I remind myself how important this is. To work, I'm working my tail off. It's I'm sweating to listen because when it's not a native, it's not our first language, it's so tricky, when you're tired. And I think that's the hardest part. If you actually know how to listen for real, which a lot of people don't, but if you do, when you're tired, then it's almost twice as hard.
It is. And I think the successful marriages, I think, and my wife, God bless her, she's a medical assistant with a local orthopedic group that we utilize for our athletics. And she is awesome at what she does because she is an active listener. And when she's talking to me, she's really helped me grow as an athletic trainer to really pay attention and listen to her cues. Because when I'm bringing in a student athlete into their office and she's just putting on a cast, or she's doing a splint, or she's helping the physician get maybe an injection ready or whatever, and I'm watching and listening to how she interacts with my student athletes, I'm like, she's tuning in. She's just not doing it. She's tuning in. And then when we're home, I mean, she's doing the same thing with our kids, and she's talking to me, and she's really helped me grow. and I'm really appreciative of her. And and that's really helped me out a lot. But a lot of times I'll catch myself like you, and she'll say, "Hello, are you even paying attention?" And she'll get right in my face, literally, and she'll like, "Hello, come on."
She's not letting you get away. She's not letting you get away with anything.
Not at all.
What I'm gonna say playfully though is, if you start meditating every day, I promise you that'll get easier. Even though it's never easy. Being a great listener, it's actually a lot of work. Even for me, and I've been, I listen for a living. It's actually hard work. It still is, even decades later. And yet it's so fundamental because you're taking in so much more information, right? I mean, if you really want to help these kids, right, the information is paramount. And when you're really listening, and especially when you're practicing those active listening techniques that a lot of people don't use, it seems like, it sounds like, it feels like, and then you paraphrase. That's the other thing I was going to say is, when you're dealing with a coach that's pissed, I'm sure you know this, but when you go into that sort of like mirroring technique of, it sounds like you're really, pissed off or whatever that is, people don't pick that up. They just feel a little more understood. They don't pick up that you're actually, in some ways controlling the situation, even though they're the ones that are pissed off.
Right. No, that's a good point. And that's something that I wish we had more training in, and myself included. I would say the people that have been the professional mentors in my life have helped me, I would say, understand that, and maybe understand what active listening is. But I mean, that is something that I wish more of in my profession we associate with, because a lot of times we are connecting more from a rehab standpoint, the mind body connection, central nervous connection, when it comes to rehabilitation, and when we talk about preventative care in injury, talking about having kind of prehab type settings where you're doing a lot more maybe neurological type work or activities to gain and improve that mind body connection when it comes to movement or improving your skill set in sport. And the athletic trainer, performance coach can take on those same cues and those same I would say kind of a directive with helping that. And that's what I love about college sports, is kind of that the collegial environment. I like that in an academic setting, because I get a chance to have an interface with professionals such as you on my campus that can kind of tell me like the neatest, greatest thing that's coming out, because I don't necessarily know what that is. But there's that collegial type of sharing of knowledge, and I enjoy that. It helps kind of help me stay in tune with the time, so to speak. And then being around the college age kids really kind of helps me maybe understand what's happening in pop culture too. So otherwise it's going to fly right by me.
Jerry, this has been an absolute pleasure for me.
Great.
Because like, as I listen to you, it's really clear that you put a lot of time and energy and focus and heart and caring into who you are as a person, into your career, and into your commitment to help others, not just kids, but, clearly it's extending beyond even the kids that you're coaching, your family, and so on. And so I just wanted to acknowledge you and say that that this has been great. It's been an absolute pleasure. And thank you for coming on Open Door with Dr. Brad.
Well, thank you. Appreciate it.
All right. Absolute pleasure. Thanks.